I'm here to talk about 22q. And 22q is a disorder. It's caused by a small piece of the 22nd chromosome missing. And it could affect any system in the body, which is a little different than some other disorders. It can be the cause of nearly 200 health and developmental issues. So there's a wide range of things that can be affected. And it's often not diagnosed or recognized as the cause of an issue for years. And it's estimated that 1 in 2,000 to 4,000 children are born each year with 22q. There's a lot of different health concerns with 22q. Some common health concerns are growth delays, feeding problems, heart disease, gastrointestinal difficulties, breathing concerns, cleft and other facial issues, calcium deficiencies, immune deficiencies, kidney problems, and skeletal abnormalities. And luckily with 22q, there's not a lot of mortality. The rate is under 4% for children with 22q. And then 95% have developmental delays, and 75% have heart defects, and 75% have cleft palate abnormalities. So there's a lot of developmental delays seen with 22q. There's a lot of educational implications with 22q. Some common ones are speech developmental and cognitive delays and ADHD. Some of the common difficulties include language, visual, memory, processing, reasoning, fine and gross motor skills, adaptive functioning, social and emotional health, anxiety, and reading comprehension. And then 90% of children with 22q have some degree of developmental disability with delays in speech. Children with 22q do have a lot of strengths. They can have focused attention. They can have good verbal learning and memory, ability to remember well encoded information, good spelling and grammar, good computer skills, word processing speed, good kinesthetic abilities such as dance or karate, rhythm and musical talent, and they have good willingness to learn. Some of the difficulties, however, they have language difficulties with receptive and expressive language, visual, spatial skills and memory. They have difficulties nonverbal processing, abstract reasoning, difficulties with fine and gross motor skills, executive and adaptive functioning, social and emotional functioning. They have a lot of anxiety, and they also have complex verbal memory, trouble with their working and encoding memory, and trouble with reading comprehension. There's a lot of family support considerations for 22q. Most children and adults do well both medically and as members of their community with 22q. And coming to terms with the diagnosis can be difficult at first, but becomes easier with more information and with meetings, and especially seeing how common of a thing it is. And there's also a really cool program that exists. It's called Dragonfly Forest, which is like a summer camp that helps support children with 22q. So all of this information about 22q helps to bring awareness. 1 in 4,000, 2 to 4,000 babies have 22q, and it's largely unknown. It manifests in over 180 ways, so it's harder to identify sometimes. But there needs to be continued awareness and support for 22q to realize how common it is and how many people it affects.